Good afternoon. My name is Nicole Willie. I have been an LPN for almost 25 years, and I currently am completing the LPN to BSN nursing program offered by Indiana State University online. This presentation is a simple review of 3 of the most common bacterial STDs. We will be reviewing what causes each STD, the signs and symptoms of each of these STDs, and the treatment for each of the STDs. We're going to begin with a pretest to determine what your current knowledge is around the STDs we are going to discuss today. And then at the end, we will follow up with a post-test just to see what you learned. So let's get started. So now that you've completed your pretest, we're going to talk about the objectives of today's presentation. At the conclusion of our time today, you should be able to explain what an STD is and how a person contracts an STD. You should also be able to distinguish the difference between a bacterial STD and a viral STD. You should be able to recognize the signs and symptoms of the 3 STDs which we will be talking about today. You should be able to identify suggested treatments for these 3 STDs as well. And finally, you should be able to communicate ways to prevent infection from any STD. So what is an STD? The abbreviation STD stands for sexually transmitted disease. A sexually transmitted disease is an infection of the male or female reproductive system that is spread by unprotected sexual contact. There are typically 2 main types of STDs, the first being bacterial and the second being viral. There are other causes of STDs, but these are the most common. The bacterial STDs are a type of STD that can be treated and cured with medication, usually just antibiotics. The viral STDs, however, can be controlled. The symptoms can be controlled with medication, but are generally not curable. Next, we're going to talk about how STDs are spread. So, as stated previously, STDs are spread by unprotected sexual contact between individuals. What you must understand is there are multiple forms of sexual contact, all of which can spread an STD. Oral sex, vaginal sex, and anal sex can all spread STDs if performed unprotected. A person can have an STD without having obvious symptoms of the disease. This is very common with male patients. There are more than 30 different bacteria, viruses, and parasites known to be transmitted through sexual contact. So here's just a little bit of background about why we should be talking about STDs in Lincoln County. According to the 2017 Montana Youth Risk Behavior Survey, among Montana high school students grades 9 through 12, 43.2% had had sex, and of that, 17.4% did not use a condom during their last sexual experience. In Lincoln County, where we live, according to the 2017 Lincoln County Community Health Assessment, for kids in grades 9 through 12, 55% had had sexual intercourse, and of that, 56% did not use a condom during their last sexual experience. Lincoln County's percentages are significantly higher than the Montana state averages. So let's learn more about STDs. The 3 common bacterial STDs that we will talk about today are Chlamydia, Gonorrhea, and pelvic inflammatory disease. So let's get started with Chlamydia. Chlamydia is an STD caused by a bacteria called Chlamydia trachomatis. The signs and symptoms of chlamydia are abnormal discharge from the vagina or the penis, burning sensation or pain with urination, pelvic pain in females, and pain and/or swelling in the testicles of males. This STD is very easy to treat. The main treatment is an antibiotic called azithromycin, 1 gram by mouth times 1 dose. And then you must abstain from sexual intercourse for at least 7 days. For people who are allergic to this type of antibiotic, there are a few other antibiotics that can be used. However, they must be taken multiple times a day for a 7-day period. Next is gonorrhea. Gonorrhea is an STD caused by Neisseria gonorrhea. The signs and symptoms of gonorrhea are very similar to the signs and symptoms of chlamydia: an abnormal discharge from the vagina or the penis, burning sensation or pain with urination, bleeding between periods for women, and pain or swelling in the testicles in males. The treatment for this one is also a one-time dose of an intramuscular injection of ceftriaxone 500 milligrams. In the case that a patient is allergic to ceftriaxone, there are multiple other antibiotics that can be used for a 7-day period. And once again, the patient must abstain from sexual intercourse for at least 7 days. Finally is pelvic inflammatory disease, otherwise known as PID. This is a female-specific infection which is caused from a female having untreated STDs. The signs and symptoms of this STD are much more significant than the other 2 STDs that we have already discussed. Females with PID experience pretty severe pelvic pain. They usually have a fever. They definitely have an abnormal vaginal discharge with a foul smell. They may have pain or bleeding when they have sexual intercourse, and they bleed between periods. The treatment for this one depends very much on the severity of the infection. Sometimes oral antibiotics can be used, but other times we even have to use IV antibiotics in a hospital setting to get rid of this STD. There is truly only one way to prevent getting any of these STDs. Do you know what that is? The only way to guarantee that you won't have one of these is to just not have sex. However, if you just can't abstain from having sex, there are a few things that you should know to protect yourself from STDs. Always, always, always use protection, condoms and dental dams. If you use latex condoms, do not use oil-based lubricants because they cause holes in the latex. Talk to your partner about their sexual history. Who were their sexual partners? Have they had an STI in the past? Are they currently STD free? Only have sex with one partner. This significantly reduces your risk of contracting an STD. Don't have sex if you've been drinking or using drugs. People make poor, unsafe decisions when using these substances. And finally, ask your partner to get tested, and you get tested before you have sex. Here are a couple of resources that you can use to learn either more about STDs or to get free STD testing in Lincoln County. This is a list of the references used to put this presentation together. As you can see, the last reference on this slide is the cdc.gov, the Centers for Disease Control. This is one of the best informational sites you can visit to learn more about STDs. Now, let's see what you learned. We're going to take that test again.